every 66 seconds. That is how often another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those words. And for some of them, the cause was never their age. It was a bottle sitting on their bathroom shelf that they were told was completely safe. My name is Dr. James Carter. For over 2 decades, I have worked exclusively with senior patients managing complex health conditions. And I have watched this exact picture play out more times than I can count. Someone sharp their entire life starts losing the thread, names, appointments, the drive home they have made 1,000 times. And everyone around them calls it getting old. It was not getting old. It was a medication. One almost nobody thinks to question because a doctor prescribed it and a pharmacy filled it. Here is what the most current research keeps showing. One ordinary everyday class of drug can pull your memory and your learning down hard inside a single year. And most people taking it have absolutely no idea it is happening. Today, I am walking you through the 9 medications most closely tied to rapid memory loss in seniors. Counted down from the ones that get quietly overlooked to the one I consider the most destructive of all. Watch for number 3. It is handed to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of your brain right now without a single warning sign. Subscribe right now and hit the bell. Every week, I publish health information your last 3 appointments never covered. Hit the like button and tell me in the comments how old you are and which medications you take every single day. I read every comment personally, and the age of this audience genuinely shapes what I cover next. Number 9. Diphenhydramine. You know it as Benadryl. It is the little pink pill people reach for to fall asleep, to calm an allergy, to take the edge off a cold. It costs a few dollars. It sits on an open shelf. And most people assume that because nobody needs a prescription for it, it must be gentle on the brain. Inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. They block a brain chemical called acetylcholine, the messenger your brain uses to lay down new memories and stay mentally alert through the day. As we age, the brain makes less acetylcholine and leans harder on every bit it has left. So a drug that blocks it lands far heavier on a 70-year-old brain than a 30-year-old one. The part that takes the hardest hit is the hippocampus, the small seahorse-shaped structure where new memories are formed before they get filed away permanently. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with people who avoided them. More than half again the normal risk, from something most people treat like candy. Read the label on anything you take to sleep and anything marked PM, nighttime, or allergy relief, because those words very often mean Benadryl wearing a different name. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, that do not cross into the brain the same way and are far safer for the long term. Never stop a medication independently. Bring it to your doctor. But stop assuming that over-the-counter automatically means safe for your memory. Number 8. Proton pump inhibitors. The big names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These shut down acid production in the stomach, and get prescribed for heartburn, reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, symptoms come roaring back. Here is what almost nobody hears at the pharmacy counter. Your stomach needs acid to absorb certain nutrients from food. Chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Turn the acid down far enough, long enough, and your B12 quietly drops. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those, and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's, when the real cause is a nutrient your medication has been blocking all along. A 2016 study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than people who did not take them. PPIs have also been shown to raise levels of amyloid beta in the brain, the sticky protein that builds up in Alzheimer's disease. If you take a PPI every single day, that is the conversation to have with your doctor. Many people can move to a gentler class called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to affect your thinking. The goal is always the lowest dose for the shortest time, not a pill you take forever out of habit. Number 7. Bladder drugs. The one to know by name is oxybutynin, sold as Ditropan. It is given to seniors dealing with sudden urgent bathroom needs, the kind of overactive bladder that can reshape an entire day. The relief is real, but oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks. And this one slips across into the brain very easily and parks itself right where memories are made. A 2019 British Medical Journal study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year found their risk of dementia was 49% higher, close to 1 in 2. And here is what troubles me most. Almost none of them were warned. They were told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. The fog gets blamed on age. People described forgetting appointments, losing their keys repeatedly, dropping the thread of simple conversations, and everyone around them nods and says, "That is just getting older." You do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most seniors, they give the same control with far less risk to thinking. Bring it up at your next visit. Number 6. Statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor. Among the most prescribed medicines in the world, especially after 60. They do an important job lowering cholesterol and cutting the risk of heart attacks and strokes. Statins belong in many people's lives, and this is not a case against them. What follows is the half of the story that usually gets left out. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the insulation wrapped around every nerve, so signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it actually needs. A 2023 study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. And the higher the dose, the steeper the slide. Not every statin touches the brain the same way. Pravastatin and rosuvastatin do not cross into brain tissue as readily and are generally considered safer choices for thinking. If you have been on a statin for years and notice fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly quit a drug that may be protecting your heart. Get the plan right with professional guidance, never independently. I want to pause here for one moment. Of the 6 medications covered so far, are any of them sitting in your cabinet right now? Type yes and the number in the comments immediately. Because the next 3 are the ones I consider most damaging of all, and I need to know how many seniors watching this are already carrying this burden without knowing it. Number 5. Benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. Among the most prescribed drugs in America for anxiety and sleep. They work by boosting GABA, the brain's own calming signal. At first, they feel like a rescue. The panic eases. The spinning thoughts stop. Sleep finally comes. Over time, the picture changes. A 2022 study in the British Medical Journal followed more than 8,000 seniors for 6 years and found those who used benzodiazepines for longer than 3 months at a 51% higher risk of Alzheimer's disease. The longer-acting ones like diazepam were worse because they linger in the body and build up in fatty tissue, including the brain. What the drug is doing is a slow chemical sedation of the whole brain. It learns new things more slowly. It grows less flexible. Many people describe a flatness, a sense of moving through fog, of not quite being themselves anymore. The cruelest part is the exit. Stop a benzodiazepine abruptly, and the anxiety and insomnia come back twice as hard, making the pill feel essential right when it is doing the most harm. If you have been on a benzodiazepine for more than a few weeks, do not stop suddenly. That can be life-threatening. Work with your doctor to taper down slowly over weeks or months. Gentler options exist for anxiety that do not sedate or cloud the mind, and specific therapy approaches for insomnia and anxiety have been shown to bring the calm back without any cognitive cost. Number 4. Amitriptyline, sold as Elavil. An older antidepressant still prescribed today for nerve pain, for sleep, even for migraines. That versatility is exactly why it spread so quietly. It looks like a do-everything pill. Underneath, it is one of the most powerful anticholinergic drugs still in wide use. It blocks acetylcholine so strongly that with long-term use, the effect on memory stops being a rare side effect and becomes the expected result. A 2015 study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and up. Those with the highest cumulative dose of anticholinergic drugs like amitriptyline over 10 years had a 54% greater chance of dementia, and almost none of them were ever told the pill could do that. They got it for sleep or pain, then slowly noticed words going missing, memory thinning, concentration fraying, and chalked it all up to age. It does not even take a high dose. A small nightly dose taken for years can quietly erode brain power with no obvious symptom until the loss is real. For nerve pain, options like duloxetine or gabapentin can give similar relief without the same anticholinergic weight. For sleep, melatonin or a very low dose of doxepin, which is far gentler on this chemical, can take its place. And for mood, newer antidepressants like sertraline are considered much safer for the long-term health of the aging brain. Number 3. This is the one I told you to watch for. Paroxetine, sold as Paxil, one of the most prescribed antidepressants used for depression and anxiety. On the surface, it looks like the modern gentle option, kinder than the old psychiatric drugs. And that appearance is exactly what makes it dangerous for seniors. Here is the detail they rarely mention. Paroxetine is the one SSRI with strong anticholinergic activity. That single fact sets it completely apart from its siblings like sertraline and escitalopram, because it reaches into the same acetylcholine system every other drug on this list has been chipping away at. A 2021 large review in Frontiers in Psychiatry examined older adults on different SSRIs and found that paroxetine users showed measurable drops in short-term memory, word recall, and attention within the first 12 months. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those on other antidepressants. There is a hard irony in that. The drug is given to steady the mind, and over time, it can wear down the very clarity it was meant to protect. The American Geriatric Society placed paroxetine on something called the Beers List, a formal catalog of drugs considered risky for seniors for exactly these reasons. If you take it, ask your doctor about moving to a safer SSRI, like sertraline or escitalopram. They are gentler and do not carry the same cognitive risk. Number 2. Antipsychotics. Quetiapine, sold as Seroquel. Risperidone, sold as Risperdal. Olanzapine, sold as Zyprexa. This one disturbs me the most, because so many people taking these drugs never agreed to take an antipsychotic. They were built and approved for serious psychiatric illness, like schizophrenia and bipolar disorder. Today, they get handed out off-label to older adults for sleep, for mild restlessness, for the agitation that can come with dementia itself. Powerful drugs meant for severe illness, now used in homes and care facilities on seniors who are simply confused, restless, or difficult to manage. A 2022 study in Lancet Healthy Longevity followed more than 25,000 older adults and found those given antipsychotics for behavioral symptoms were 71% more likely to suffer worsening cognitive decline within a year, even with no history of dementia before they started. These drugs also raise the risk of stroke, sudden cardiac death, and the heavy sedation that leads to falls and hospitalization. They work by suppressing dopamine, a chemical tied not only to mood, but to focus, planning, and memory. Drop dopamine far enough, and the brain goes slow and unresponsive. People on these drugs can seem dull, flat, almost absent, while their families grieve someone who is still sitting right in front of them. If you or a loved one is on one of these, ask the prescribing doctor a direct question. Why was this started? Most behavioral symptoms can be eased without medication through steady daily routines, less noise and overstimulation, treating hidden pain, and fixing light and sleep. When medication genuinely is needed, the lowest dose for the shortest time keeps the harm down. Far too often, no one ever tells the family what these drugs do to the brain. Number one, and this is not a single drug at all. Number one is anticholinergic polypharmacy, the danger almost nobody names, and possibly one of the largest causes of drug-induced memory loss in older adults today. You were probably waiting for one final villain, one worst pill. The real worst case is something subtler. The slow stacking effect of taking several anticholinergic drugs simultaneously with nobody adding up the total. Picture a very common situation. A senior takes Benadryl every night to sleep, oxybutynin every day for the bladder, amitriptyline for nerve pain, and paroxetine for anxiety. On its own, each one might cause only a small, barely noticeable dip. Taken together, they compound, and the total burden on the brain climbs fast. A 2022 study in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double. And the vast majority had no idea they were on anticholinergic drugs at all. No one had ever explained it to them. When you block acetylcholine from several directions simultaneously, the brain does not just idle. Neurons begin to wither from disuse, connections shrink, and the brain settles into a quiet, underpowered state that looks almost identical to Alzheimer's on testing. Here is the hopeful part, and it is the reason I made this video. Drug-induced decline is often reversible when caught early. Remove the burden, and many people get their clarity, their energy, and their memory back within weeks or months. The brain is more resilient than we give it credit for, but only if you take away what is hurting it. The fix does not take a miracle. It takes a careful medication review. Sit down with your doctor or pharmacist and have them go through every prescription, every over-the-counter pill, and every supplement, and add up the anticholinergic load. There are simple scoring tools that do exactly that. Once the problem drugs are identified, you can taper off what you do not need, switch to safer alternatives, and give the brain the room it needs to recover. This is the most preventable threat to the aging mind on this entire list, and that is exactly why it sits at number 1. 3 things in the comments before you leave. Which of these 9 medications are currently in your cabinet? Whether you have noticed brain fog or memory changes after starting any new medication, type yes noticed or no not yet. And type medication review if you are committing to asking your doctor or pharmacist for a complete anticholinergic load review at your very next appointment. Share this video with every senior you know who takes multiple medications and has noticed their memory or clarity changing, and assumed it was simply age. It may not be age. It may be the cabinet. I am Dr. James Carter. Your brain is not finished fighting for you. Make sure the medications meant to help you are not the ones quietly winning that fight against you.